Now, the country has been left to deal with the dark cloud of rolling blackouts yet again. Businesses, learning, healthcare and service delivery have been affected. Now, power cuts are also affecting water supply in some areas. Our reporters on the ground keeping an eye on the situation. Lindokuhle joins us from Johannesburg and Nobesuthu Hejana is in Cape Town. Good afternoon, actually good morning to the both of you. Lindo, perhaps to start with you, how have the hospitals actually been affected by the power cuts?
It's something we want to find out, Mfundo, in terms of how this has affected important sectors within our communities. Earlier on, we were with SADU, the Teachers Union, just giving us a sense of some of the things that are affected by this. But right now, we want to check in with the health sector. We are with Ubaba Usibongiseni Delihlazo from, of course, Genosa, who's just going to give us a sense of the health sector's perspective as far as, you know, the medical staff is concerned. Thank you so much for joining us. First of all, just give us a glimpse of how stage 4 load shedding has affected you, your colleagues, and in fact the sector in general, the health department.
Well, thank you, Lindo. There is an effect, a very negative one. It's the news that we really do not want to hear, considering that load shedding has been with us for a number of years now, and each time there's an announcement of load shedding in various stages, would plead with all facility management to ensure that the facilities have their standby generators in good condition, ready to kick in should load shedding hit the facilities. Unfortunately, it is still happening. We've been getting reports from provinces, for instance, in the northwest. We are getting reports that in the Mafikeng sub-district, many healthcare facilities are affected. And also the Mafikeng Provincial Hospital itself, and also many healthcare facilities in the Bojana region, still in the northwest. That is very much disturbing to us because a load shedding, when it's announced, it prepares you as an institution to ensure that all your ducks are in a row in as far as preparation. But it still seems as if it's an area that not many healthcare facilities do not see the essence of ensuring that it does kick in the generator when load shedding hits. Our gripe mainly is with the maintenance of our generators. Institutions are neglecting maintaining their generators. It's a lot of work for our healthcare workers. It poses many risks in their career because should something happen in facilities, as it often does whenever there's load shedding and there's not, the generator does not kick in. Just imagine, for instance, in a unity section, in a maternity section, when it hits and nurses are busy with the procedure, overseeing the birth of a newborn, it just gets dark. It's a risk to their lives. It's a risk to their careers, to the lives of the patient. Also a risk to their careers because they will be charged should something go wrong in that process, regardless of whether there was load shedding. Now we have to go to the regulatory body and defend these nurses unnecessarily. It's the time that I believe we should be spending, servicing our members much better than defending them over a matter that should have been avoided had institutions stick to maintaining their generators. Unfortunately, there seem not to be any lessons from provinces like the Western Cape. Whenever we are touch basing with provinces, the Western Cape reports zero incidents mostly, because they say every Friday in the morning they test their generators and they refuel when there's a need to. Many institutions in other provinces like Gauteng, especially in the Sedibeng district, where many healthcare institutions are also hit the hardest by this, it's because of poor maintenance of our generators and also no money to buy diesel, for instance. It's a legal thing, the legal basics that they are quite embarrassing to be still talking about in this day and age. I think it's since 2008 when we are announcing the issue of load shedding. It's a phenomenon that should be preparing for, but our main concern is the risk that our healthcare workers are facing as a result of this.
I want to move on to some of the important things that you are saying. You are indeed saying that it's quite important that the lights be kept on, but because of the lack of maintenance, you find that there are some pickups in terms of issues of incidents that you need to defend nurses and health workers around. But tell me, in this instance, since ESCOM announced, in fact, not even stage 4 yesterday, but stage 2 then, have you had any reported incidents?
Well, that we have not heard of any reported incidents. may not necessarily mean that there are none. It may be that perhaps it will take time for us to be made aware of such. That is what is likely to happen, Lindo, if you are not prepared as an institution. Because nurses work with lives. And in serious sections like ICU, theatre, you talk of trauma, you talk of maternity units. Those are risky areas that you can't afford to even improvise, because improvising may also compromise the quality of healthcare that you are providing as a healthcare professional. But what is often disturbing to us is to see nurses having to improvise over a matter that we do not think, as I mentioned, we shouldn't even be in at the stage that we're in, where they will have to use their cell phones to oversee the birth of a newborn simply because there are no lights. I mean, we're having a serious concern with the municipalities in this country. Municipalities are still lumping your essential services like healthcare institutions with your consumer categories in their grids. We want municipalities to put healthcare facilities under their essential consumer grid, so that especially when you know that you have to switch power for this area, you just switch it for the consumers and not for your essential service centers. And that is the most area that we think our municipalities are not seeing as important. And our government needs to look at itself and see how they can really, really achieve quality healthcare services that we are providing to our communities. The issue of generator, I mentioned, a generator must not light up the whole institution. The key areas that are quite risky to our healthcare workers, you must at least cover those.
Yeah, not a matter to be rushed, but we are out of time. But I still need to ask, there are reports that are being received that food suppliers, especially around, have been paid, and there are situations playing out within other health institutions. Just capture for us what you've heard around that, and what is it exactly that is happening in our health institutions around food.
Well, that is quite disturbing, Lindo. Again, it's an embarrassing area that we should be talking about at this day and age. Institutions in Gauteng are running out of food because Treasury in the department has not paid food suppliers. Not only food suppliers, even waste management companies that should be collecting waste in many institutions. Those institutions are being affected. Food is running out. Now nurses are having to buy food for patients out of their own pockets, including the doctors. I mean, with which money? Because there's not been any increment for years now, in terms of government workers. So it is embarrassing. How dare government does that to the patients, because nutrition is right at the core of a patient's recovery. If you neglect that area, what essence are you in terms of being still regarded as a government? You're just uncaring, and that's the proof that you are giving to the public.
All right, thank you so much. Mouthful there, myriad of issues that really need to be addressed. Unfortunately, we have run out of time, but importantly, speaking about the effects of stage 4 load shedding, and just at the tail end, speaking about issues that are looming, such as the running out of food and nurses having to cough out money to buy patients food because suppliers have not been paid.
No, those are honestly very disturbing revelations. That's Lindokuhle. Nobesuthu, perhaps to come to you, we understand that you've been stationed at Home Affairs. I can imagine the frustration with load shedding, especially because accessing services there on a normal day still is somewhat time consuming because of the queues. What are people saying to you now?
Certainly, Mfunda. In fact, when we got here around about 8 o'clock this morning, it was packed, and quite a number of people were complaining about the service being slow and complaining about the systems going on and off, and saying that even the security personnel who are trying to monitor these queues outside are not doing much. In fact, they were fighting also. They're claiming that there are people who sleep on the queue and are selling spaces to those who would come in at 8, and we spoke to one lady earlier on who was saying that she slept here so that she could be in front of the queue. But I'm now joined by Yumna Williams. She stays in Delft. Yumna, you were telling me when you left your home it was load shedded. Tell us about the traffic and how long it took you to get here in town.
It took about 2.5 hours because of the load shedding. And the robots that is not working. There was an accident also in Delft on the corner of Symphony and Erika Wing. 2 taxis collided. And when we came here, they gave us a time of 11:30. And And when we came here at 11, they say we must be here before half an hour before the time. But when we came here, the security told us we must stand outside. They will call us. And it's almost it's now 25 past 11, and we're supposed to get married at 11:30, and we're still waiting. In the sun, we must stand here. Why must we stand here if we have an appointment? I came here early because of my appointment, but now they say you must stand outside. Why?
And now, obviously, it delays your process now.
Yeah.
And obviously, you came with people who are here to be the witnesses.
Yeah.
Tell us about the frustrations from them also.
Yes, they are frustrated because they thought it's just an in and out business because we have an appointment. If you have an appointment, you go in. You have to go in by your appointment. But now the security say we must wait outside. These people are frustrated now because I've got 2 people with me who's my witness.
Yeah. And the lady that we also spoke to, who was standing there under the shade with you, she was telling us that she was inside and then she was told to go back to the queue because she has a different appointment or something else to do. Tell us about these systems and the fact that people are complaining about the delays.
You know what? My daughter was here last month. Yes, it was last month. No? She said that security told her she must be here at 3 o'clock in the morning. How can you be here at 3 o'clock in the morning? There's no transport for you to come to here. She don't have her own transport. She must take the public transport. And there are some people that I saw when I came for my ID last year. I saw some people were sleeping here. Old people. And you know what? One day, when I come and pick up my ID, they told the lady she's not 70, she can't go in. She's 68. She can't go in because she's not 70 yet. Only people 70 and older can just walk in. But why not a lady of 68? And she have to stand with us in the queue in the sun. Is that fair? That's not fair towards people. We are human beings. Why are they treating us like that? And to say you must be here at 3 o'clock. No, man, you don't even do that at the day hospital. Why here? There's no shades here. And if you stand in the shade and they come and fetch you and you go back, they say you weren't in the queue, but you were in the queue. It's only you were standing this side because of the shade.
All right, thank you very much and congratulations. It's your big day today. I hope everything goes well and it's worth the wait. Well, Fundo, that was Yumna Williams. She's telling us that she was supposed to get married at 11 o'clock, but unfortunately because of the delays inside, she was told to go back outside and she's waiting with her husband to be and the 2 witnesses that she brought in. But those are some of the frustrations shared by quite a number of people who are here and also citing the impact of the load shedding. She did say that when she was driving to town, traffics were not working, which is something that many people have been experiencing. We know that Eskom supplied customers are still on stage 4 until Friday, but those who are supplied by the city of Cape Town are to remain on stage 3 also until 10 o'clock this evening.
All right, Nobesuthu, we'll leave it there for now. Thank you very much. That is Nobesuthu Hejana. A bit earlier we spoke to Lindokuhle, who's in Johannesburg.